Hello everyone. Today we'll be talking about why is digoxin contraindicated in hypokalemia. So basically digoxin is a cardiac glycoside drug. It's actually used for two purposes. It has a role in bradycardia and also it has a role in increasing the contraction of the heart, that is called as inotropic action. So basically how does it work? It works by acting on sodium potassium ATPase. So let us assume this as a myocardial cell or a myocardium. So what happens is, so this part that is inside, so this is inside of a myocardial cell or inside of a cell is myocardium, and this is outside of the cell. So outside part is this part. This is a cell membrane or a barrier. So what happens in that, in every cell membrane or barrier there is sodium potassium channel. So what is the normal function of the sodium potassium channel is that it will bring potassium from outside to inside the cell. And what we do in exchange, the sodium is removed from inside to outside. So that's why it is called as 3 sodium and 2 potassium channel. That is, for every 2 potassium molecule, 3 sodium will go out. So now assume that okay, once the sodium has gone out, so this sodium will again come back inside the cell via sodium calcium channel. So that means the sodium will come inside and the calcium from the cell will be going outside normally. Okay, now what happens is that, okay, let us assume now we have started them on digoxin. So digoxin will actually inhibit this sodium potassium channel. So if it inhibits the sodium potassium channel, what will happen is that the potassium which was supposed to come inside will not be coming to inside anymore. Okay, so potassium levels will be remaining high outside of the cell. Similarly, the sodium which was supposed to go out will not go out anymore, and the sodium will remain inside the cell. So once sodium amount is very much high inside the cell, there is no need of further sodium inside of the cell. So thus there will be inhibition of the sodium calcium channel as well. So no calcium will be going from inside to outside. So calcium amounts will remain high inside the cell. And as we all know, more is the calcium, more is the contraction. So calcium is required for contraction of any cell or muscle. So more number of calcium inside the cell, more will be the force of contraction. So this is the normal mechanism of digoxin. Now, we have already said this, digoxin is inhibiting this channel and thus potassium is not coming to inside of the cell. So what should it lead to? It should actually lead to increase in potassium outside the cell, or it may lead to hyperkalemia. But now the question arises that okay, there is a theory that hypokalemia is a contraindication for digoxin. So in hypokalemia patient, digoxin should not be given. So although digoxin causes hyperkalemia, it is contraindicated in hypokalemia. So why is that? We'll explain it now. So what happens is that this digoxin and the potassium, so the place where they bind on the channel, on the sodium potassium ATPase channel, the site is same. So actually there is a competitive antagonism. That is a sodium, that is a potassium, and so this is a potassium. For you assume this as potassium, and they assume this as a digoxin. So they both will now compete for a same receptor. The site of binding of both of them is similar. When the site of both of them is similar, if there is hypokalemia, that is less amount of potassium, so less will be the competition for digoxin. So now what will happen? Digoxin will go and bind to more number of sodium potassium ATPase channel. For example, it was supposed to bind 3, now it will bind to around 5 to 6. So more is the digoxin binding, more will be the calcium inside the cell. More is the calcium inside the cell, more chances of contraction and more chances of arrhythmias as well, because there is an electro abnormality happening because of digoxin. So, and we all know digoxin has a very narrow therapeutic index. That is, too much of digoxin and too less of digoxin is both dangerous. Maybe less, that means the less number of digoxin may not be very much effective, or too high could be causing lots of side effects. So if there is no potassium, there is no competition for digoxin, and more is the action of digoxin, more chances of side effects. So that's why digoxin is contraindicated in hypokalemia. Digoxin competes with potassium, binding to cellular sodium potassium ATPase pumps, and thus predispose the patient to digoxin toxicity. Hope you have liked my video. If you have any doubts or any comments, do it in my comment box. If you want me to teach any other topic, please let me know in the comment box. And do subscribe to my YouTube channel, Dr. Akif Beg, for more interesting videos. Thank you.